To end the threat of the COVID-19 pandemic and strengthen global health security, the global COVID-19 response and health security assures of the continued availability of COVID vaccine across the world, especially developing countries. In an exclusive interview with TVC News, the coordinator, Gail Smith, speaks on the importance of everyone getting vaccinated.
Nigeria is one of the countries with the highest hesitation on the COVID-19 vaccination. While a little over 50% of the world population has received at least one dose of the COVID-19 vaccines, just about 3% of Nigerians have taken at least one jab of the vaccine. I sat down with the coordinator for global COVID-19 response and health security, Gail Smith, to talk about issues around COVID-19 vaccine hesitancy and the importance of taking the jab.
Well, I think it's improving, but we're not where we need to be yet. If you look at where we need to go, which is to 70% vaccination coverage in every country in all income categories, we're a long way from that. It's an achievable goal, so I think we're on the path to it, but we're not there yet, so we've just got to keep going as hard and as fast as we can until we get there.
Okay, if you say keep going, what are the plans to ensure that everyone is on board?
Yeah, well, there are a few things. One is making more vaccines available, and we, as you may know, are doing that. We are sharing vaccines. We've shared a significant number from our own stocks. We are buying 1 billion doses of Pfizer vaccine to make those available through COVAX. We're happy to be working with the African Union and their Africa Vaccination Acquisition Trust to work with them on a deal they recently did with Moderna that will bring more vaccines into the mix. And we're investing in increased production that can meet the need now. So all those things have to happen. More doses need to be sold at an affordable rate. More doses need to be donated. More doses need to be procured and faster. So that's the plan. But the other side of it is that it's one thing to deliver vaccines to an airport. We've got to deliver vaccines to people and make sure that vaccines become vaccinations.
Hesitancy is still very much high among the people. Why so much effort into production rather than creating awareness and making people understand the need for the vaccination?
No, it's a good question. You've got to do both, right? You've got to work on the supply side because the supply has been woefully low, particularly if you look at coverage in Africa, and on the demand side. And what we're finding is that hesitancy comes from a number of things. Sometimes when there's not a regular supply, people aren't seeing vaccination programs occurring. It's not available everywhere. So there's a little bit of, why should I go seek it out? There's some hesitancy that comes out of fear or lack of information about how effective the vaccine is. And then there's a disinformation problem. There are people out there actually countering the science. I think what we've found around the world is that once the supply goes up and the rhythm starts and people start to see that people who are vaccinated are safer than people who aren't vaccinated, that helps to get the numbers up.
She assures that there are no underlying notions behind the COVID vaccination other than overcoming the monstrous pandemic together.
People who are fully vaccinated get the virus less often than those who are not vaccinated. And when they do, they're very unlikely to be hospitalized or to suffer severe consequences. So that there have been cases of people who've been fully vaccinated who still get the virus. It's a relatively mild case. Where we're seeing the increase in the number of cases and the number of deaths is among people who are not vaccinated. So I think we've got plenty of evidence to show that it does keep people a whole lot safer and a whole lot healthier. And the numbers are there. I got the vaccine. Here I am, I'm fine. I'm traveling in Nigeria. I still take precautions and wear a mask where guidance suggests that I do. I'm very grateful to have gotten a vaccine because I've seen what this virus can do. And I've seen what happens if we don't protect ourselves and each other. So I would encourage people to get vaccinated. Protect yourselves, your families, your communities, because together, if we do this, we can defeat a virus that's disrupted every one of our lives.
As people around the world desire and clamor for a return to normal life, getting vaccinated remains the only way out. excuse of vaccine hesitance in Nigeria has been the fear of the jab introducing the virus into the body. Science has shown that this is not true. The jab only builds the body's immunity against the virus. It is important to continue to reiterate this, as in the words of Gail Smith herself, no one is safe until all of us is safe. Moya Thomas, TVC News, Abuja.